Hello, my name is Rebecca Harper, and this is my presentation on communication and the health belief model. Per the CDC, health communication is a method to inform and motivate individuals and populations to improve their health outcomes through health information. This information can come from ad campaigns on TV or in magazines, on billboards, from their healthcare providers, neighbors, friends, or family. The health belief model predicts that individuals are more likely to take preventive action under the following conditions. If they believe they are susceptible to a specific health problem, it is perceived susceptibility. If they believe the health condition will lead to potentially serious consequences, that is perceived severity. If they believe that a course of action available will be beneficial in either reducing their susceptibility to or the severity of the condition, this is the perceived benefits. And if they believe that the anticipated barriers or costs of taking an action do not outweigh the benefits, this is perceived barriers. The cues to action can be personal or social events that can teach the importance of taking action, such as a neighbor that becomes ill with a disease process, or a campaign locally to promote disease prevention. Self-efficacy is the person's confidence in their ability to perform and sustain the behavior with little help from others. The health belief model was originally designed to explain why people did not participate in programs that could help diagnose or prevent disease. They found that behavioral change can occur as a result of a change in the variables. This model is used to understand the behaviors. It focused on perceived threats and expected outcomes. The article by Yu, Kwan, and Pfeiffer, titled Influence of Communication on Colorectal Cancer Screening, Revisiting the Health Belief Model, is a study that's looking at how communication factors such as the media and interpersonal interaction with neighbors, friends, family can influence people to get colorectal cancer screening. They used participants from the Health Informational National Trend Survey, or HINTS. They were looking at persons that had done the colorectal testing through Hemocult slides. The study design was a secondary analysis. It randomly called persons in the HINTS study that had had the stool sample test. Persons that answered the phone would be asked if they would participate in a telephone questionnaire. They were asked if they had a family member or a neighbor or friend that had had colorectal cancer. They were asked if they read health magazines or watched the health segments on the news, or if they searched for specific information, such as on the internet. These are the results of the study demonstrated in a structural equation modeling diagram. And it shows the relationship between the factors. It was found that there was a direct relationship between both the perceived threat of cancer and positive expectations to colorectal cancer screening, which are these two right here. They were a positive effect. The study did not demonstrate a direct link between the mass media and the colorectal cancer screening. It did, however, note that the mass media had an effect, though small, on the perceived threat and on the positive expectations of the cancer screening. So it did have an indirect effect on the colorectal cancer screening. The authors also noted that on the internet, half of the links on this colorectal cancer are commercially oriented. So if someone does a search, half of what they find is containing information on goods or private health services. And of the other information, only 1% of that is from healthcare professionals. The authors noted that there were study limitations to the in that it was secondary data from an original study, and also that they only performed the test on persons that had had the Hemoccult stool testing and not some of the other forms of colorectal screening, such as colonoscopies or flexible sigmoidoscopies. In conclusion, the authors felt that the mass media and interpersonal communication had a positive influence on a perceived threat and the likelihood of persons getting themselves tested for colorectal cancer. The health belief model can be used for this analysis. And these are demonstrations of ad campaigns from the CDC with Katie Couric and showing interpersonal discussions between persons as well as national campaigns. Thank you very much for your time. These are my references. If anyone has any questions, please post them below my posting. Thank you.